Good afternoon, everybody. For those of you who don't know me, my name is John Iredale. I'm the Interim Executive Chair of the MRC. You are all extremely welcome to this webinar on our Strategic Delivery Plan. I should say at the outset that this is being recorded and will be available together with the answers to the questions, not only those obviously which will be recorded later on in the session, but any unanswered questions which we will endeavour to provide answers for if we run out of time. We've had something like 470 individuals who've signed up for this from a range of career stages, which is terrific. We've got representation from industry, charities, other partners and stakeholders, so everyone is very welcome. So the agenda this afternoon is, in a moment, I'll introduce a colleague, Jonathan Pearce, our Director of Science Strategy, who will talk you through the Strategic Delivery Plan. We'll then have the opportunity to ask Jonathan any particular questions that arise as a result of his presentation. And following that, for the final 30 minutes of the webinar, we've got an open Q&A session. Many of you have taken the opportunity to send in questions ahead of time. So that's been extremely useful because it means that we can prioritize addressing some of the common themes that have come through. So what I wanted to say right at the beginning, just before we allow Jonathan time to present, is that this is a comparatively unique position for MRC to be in, certainly since the inception of UKRI. The agreement with the government through BEIS of a 3-year funding settlement has allowed MRC and UKRI, of which of course MRC is a constituent, to really think very hard about a strategy that moves beyond responding to an annual cycle of agreed funding. And this has allowed us to co-create with UKRI our own strategic delivery plan. And it's important, as well as understanding what MRC is proposing to do, that our own strategic delivery plan is also a component of the UKRI strategy. And the UKRI strategy is in essence a document which contains an overarching strategy that is then underpinned by the 9 strategic delivery plans of the individual councils, including, of course, MRC. So this has been a great opportunity for us to think about the future and to really plan in a meaningful way, in a manner that we haven't actually been able to do, as I say, since UKRI was first conceived and developed. I don't really want to say any more than that because really the meat of today is about our discussion and you having the opportunity to ask questions. So what I propose to do is to hand over to Jonathan, who will talk us through the MRC Strategic Delivery Plan. So Jonathan, over to you.
Good afternoon. My name is Jonathan Pearce. I'm Director of Strategy and Planning at the MRC, and just to thank John for the introduction. So I'm going to provide a few slides on the Strategic Delivery Plan to kind of bring out some of the highlights from within it. And then, as John said, we'll pass to a panel session where we can address questions that may have arisen from it. So I'm just trying to go through to the next slide. Inevitably, having done this for many, many months, it now won't work. I'm just going to try to stop sharing. Hang on a moment. Share again. Lovely. So as John was saying, the Strategic Delivery Plan that I'll be presented from the MRC sits within an overarching strategy of UKRI. And this strategy, which was published earlier in the year, provides the framework under which we both operate as UKRI, but then again as individual councils, and really importantly, different levels between that. And as we come through the MRC Strategic Delivery Plan, I'll be highlighting elements that we're kind of delivering from an MRC perspective, but other important elements that we are capturing the opportunity afforded by UKRI, both at scale and scope, in order to better deliver against our mission. The framework of the plan is, on this instance, focused on impacts, places people and careers, ideas, innovation, a world-class organization. But as I say, what I'll be doing is to provide bringing that alive within the MRC context. As a bit of additional background, as John alluded to, not only do we now have a strategy, and the UKRI strategy is a 5-year strategy, we also have a spending review settlement where we, of course, listen with interest as to the security of this within the current changing government environment, but nonetheless, at the moment we have a multi-year settlement which allows us to move from a much more responsive environment to a planned environment and be able to set out these plans, which I will be sharing with you today, because it's clearly critical that we are able to provide that path of certainty to the community so that we can build the really critical partnerships which are going to be necessary for the delivery of these and other plans. The SR settlement in total was a very positive outcome for UKRI, with a settlement of 25 billion over the next 3 years, and that means that our budget is rising from 7.9 billion, in 22-23 to 8.7 billion in 24-25, which is a 14% increase. It is, of course, to be recognised that there are other important sources of funding for the biomedical sector, including other budgets within BEIS, the devolved administrations, and very critically, our charity partners. And it's through our collective action that we can best address our shared goals. From an MRC perspective, we also had a good uplift in our budget. Our total core budget is going to be 1.75 billion over the 22-23, 24-25 period. For us, that's a 9% increase in our core research budget, rising from 560 million to 620 million. This budget, it'd be important to recognise, does not include some important elements of our existing and future planned spend, including in our ongoing response to COVID-19, large-scale infrastructure investments and cross-UKRI strategic programs, which I'll come on to in due course. And because of our move within UKRI to moving our talent and careers to a collective talent line and collective approach, which again I will pick up on, that budget is also not included. That's just to explain why the budget that we're presenting here may look a little different to the totals that we would have presented in the past. Looking at the MRC Strategic Delivery Plan then, this sets out first of all our coordinating purpose, which is to accelerate improvements in human health and economic prosperity by supporting world-class biomedical research and innovation and strengthening partnerships within UKRI across the UK and around the world. As you will see from this diagram, ideas for us are at the absolute core of that, the kind of bottom investigator-led, curiosity-driven research, which has been absolute at the heart of what we do, remains fundamental to our ability to deliver on our purpose. So we remain committed to funding world-class discovery science and driving an integrated understanding of human disease. And I'll come on to some of the ways that we're looking to be supportive of that agenda. We clearly then have schemes which take those ideas and support their innovation and translation. And then importantly, we also have areas of work which are focused on delivering impact against the most serious disease and other burdens that we collectively face. Underpinning all of that, we need to be supporting the diverse skills and capabilities needed to deliver on those ambitions, and that's both within and across different disciplines and sectors, and ensuring that we have an open and collaborative research environment. And we're providing the support for the infrastructure that is also necessary for that research to be undertaken. Collectively, we are also looking to strengthen our own organization through including strengthening our equality, diversity, inclusion elements, and supporting a more effective and agile organization, including with improvements to our services that we provide to the community, including through, for instance, a strengthened funding service. To go into these in a little more detail, first of all, looking at world-class people and careers, we recognise the criticality of this area, and whilst our overall budget, as I alluded to, is increasing by 9%, we will be making a significant increased investment in this area, increasing our budgets through our panels and fellowship schemes by 30% to invest 80 million per annum over the SR period. This reflects, as I say, both the recognition of this being a critical part of the overall package, but also it takes into account some of the changes within our partner organisations and the pressures that that's putting on the community. We are working across UKRI to look at how can we take a collective approach to talent. So that's bringing the best of our various schemes and approaches together to provide a more coherent offering to the community. But I would say that within that, we are clearly looking at how do we retain the deep domain expertise that each council brings to that, and is also considering the particular nature of the skills and expertise gaps within each of our fields. So for us, including recognition of, for instance, clinical research fellowships and other areas which do sometimes need special consideration due to the nature of time commitments and costs sometimes associated with that. We will be looking very carefully to ensure that those elements are retained through this collective approach to talent. In other areas, and I'm sure that many of you will recognize this through your own work, there's a need for us to strengthen digital and data science skills. And again, this is a need that crosses over multiple councils, and looking at how we take that collectively to include both the mathematical and other sciences which are needed to deliver on these ambitions. We're looking to promote a stronger culture of public and patient involvement. We're actually currently undertaking a strategic review of our approach to public involvement, particularly in a preclinical setting. There are some very good models for how we do this in a clinical environment, but we're really keen to look at how do we better involve public in decision making, both as to the nature of the research. So what are the priorities for research that we're undertaking to ensure that the research we do has impact and meaning for all of our diverse populations within the UK and worldwide. We're also looking and have recently published guidance on increasing diversity in research design, looking particularly at sex within animal work, but we are also now looking at diversity across multiple characteristics within human participation. And we do recognize that this could have cost implications, but we think that it's really important that the work that we support does appropriately reflect the diversity of the populations and communities that we serve. Looking at place, we are actively challenging ourselves about the opportunities that taking a more proactive consideration of place provides, and that can include both in working with different clusters, different manufacturing and industry capabilities, and also working with different populations as examples. And we are launching a new unit model, which will offer opportunities for considering place through some more distributed elements. And that model is also to look at how do we best capture opportunities over the lifetimes of a scientific development curve. So what is the length and scale of investment that best matches the need for our communities to take high risk opportunities that we need if we're going to have the breakthroughs in delivering on healthcare that we strive for. We're also looking to strengthen international partnerships. We might want to come back to this in discussion around the panel, but we're not only kind of have our long-standing commitments to global health, and we'll continue to provide around £50 million of funding within the global health environment through our Applied Global Health Research Boards, but we're also actively working with BEIS on the establishment of a new International Strategic Priorities Fund, which will take elements of both the Newton GCRF and Fund for International Collaboration to provide strong partnering opportunities for countries across the globe. We also recognize that infrastructure is a critical component to what we do, and we have now instigated an annual call for mid-range equipment, recognizing that this was a particular challenge for the community as to how do you fund the equipment in those pieces of equipment that you couldn't get onto an individual grant nor make a individual strategic case for. So that's now an open rolling opportunity. And working across UKRI, we've been able to pool our capabilities and financial support through bidding in to a cross UKRI 3 billion infrastructure fund, and that is enabling us to provide significant new support in areas such as population health sciences, where we're establishing Population Research UK, which is to coalesce our long-standing longitudinal population cohorts and studies, both from a health and administrative perspective, working in partnership with the ESRC, and establishing a 100,000 person adolescent health study, which is to fill a specific gap in our population study portfolio at that very critical time point in our lives where you can actually lock in both behaviors and lifestyles and other features which have longer term playouts in terms of health and health impacts. We're also supporting significant new work in imaging, both in 11.7 Tesla mRNA and in total body PET, and working collectively across UKRI to consider what are the needed digital capabilities, the trusted research environments, interconnectivity, etc., between them through DARE UK. Looking at world-class ideas, we also recognize that we've had some challenging times in the recent past with kind of success rates within our responsive mode schemes. So we are increasing our commitment to those schemes by 18%, and we'll be investing around £200 million per annum throughout the SR through our research boards to support the best investigator-led discovery science, which, as I alluded to before, really is and remains the kind of groundswell of the work that we're able to support. As part of our drive to have a better integrated understanding of human disease from molecules and populations, we will be initiating a major initiative first in functional genomics, and that will be looking at how do we bridge between the enormous successes of our large-scale population bioresources, including UK Biobank and other initiatives to develop a great understanding of kind of genome-wide association studies, but how do we take those associations and actually understand the priority mechanisms that can allow for both preventative, diagnostic and intervention approaches to address the complex diseases that we as a population need to address. Looking at the innovation agenda, we are working both with government and industry partners to deliver upon government's 2.4% GDP RNI target. And this will include increased investment through our translational funding schemes of £60 million per annum. And that will also include our recently established experimental medicine panel, which is capable of looking at larger cost cross disease area opportunities in experimental medicine. Other areas that we'll be concentrating on include developing further our approaches in advanced therapies, and that's both to kind of better serve the existing suite of advanced therapies, but also to look over the horizon as to what the new approaches are and what their new capabilities, manufacturing, etc., will be needed in order to be supportive of their prosecution. We've recently launched a new call for rare disease research platform that's working in partnership with National Institute of Health and Care Research. And much of the work that we do clearly has to be done in close partnership with our colleagues at NIHR and their DA equivalents to ensure that we're getting the pull through of the ideas that we generate into practice and policy. We're also really keen to expand the range of industry partners that we work with. We recognize that there are great opportunities to increase the nature of our engagement with small and medium-sized enterprises, particularly in areas such as health tech and diagnostics, but also working with digital companies to access capabilities in AI, data mining, and the application of digital technologies within healthcare. Looking then at some of the opportunities for impact, and this is where we're working collectively together within UKRI under the UKRI strategic themes, and those are highlighted within the SDP, but they're also set out within the UKRI strategy. Two ones which are key for us are working collectively across UKRI and with other partners to secure better health, aging and well-being and tackling infections. And examples of the types of work that we will be launching in these areas include a minimum investment of £15 million in a new mental health research platform to support development of novel markers and targets for detection, prevention and treatment. And that work is aligned with the work of the life sciences vision to instigate a mental health intervention analysis platform further downstream. We're also looking to make a minimum of £60 million investment in the development of better, more durable vaccines. We recognise the incredible breakthrough impacts that the COVID-19 vaccines have had, including the work of Oxford and AstraZeneca, which was work that was supported by the joint UKRI-NIHR call through the COVID-19 research response. But we also recognize that they have limitations in terms of their durability and their ability to block transmission. So if we can make advances in those areas, those could have both great benefits within COVID, but also spillover benefits into other respiratory diseases and pandemic risk diseases. We're also working across government and with other UKRI partners to develop a £90 million neurodegeneration initiative, of which MRC would be making a £20 million contribution, and that's to further the prosecution of early stage dementia and neurodegeneration intervention studies, working in partnership with industry. Finally, in terms of a world-class organization, I've highlighted that we are looking to embed equality, diversity, inclusion in everything we do. And we're also setting ourselves stretching targets and to ensure that we've got diverse populations within our research boards and panels. Those aren't just targets, though. We're also going to be establishing active schemes to bring on underrepresented communities onto those boards and panels through providing them with the opportunity to participate in those panels at more junior levels in order to give them the understanding as to how they operate and to therefore provide hopefully a better opportunity for them to apply for membership to those panels. We are looking to reduce the bureaucracy and increase the effectiveness of our organization, and that's including through a new funding service, but also I would highlight again this coordinated activity as individual councils and collectively as groups of councils and as UKRI to have the greatest impact that we can hand. We're also working directly on our own estate and operations to achieve net zero by 2040. And we will be embarking on work to better understand the impacts and the kind of carbon contributions of the research that we support, to also consider how do we collectively look to reduce the impact of our work in this important area. So I'm going to come to an end there. And I think, John, we were planning to move to questions. We stop sharing.
Indeed, indeed. So what we were interested in doing before we go to the plenary Q&A session was just to field any immediate questions, particularly for Jonathan. But I've realized that those Q&As, which I can no longer see that have come through, would be better answered, I think, in the general section anyway. So what I'm going to suggest, folks, is that we move to the general Q&A plenary session, and I will introduce the panel to you in just a minute. And what we could do is highlight those first three questions that have come through, Jonathan, during your presentation before we move on to some of the questions that have arrived ahead of this session. Because they're interesting, and I think we would benefit from having the whole panel's input to them rather than just you and I. So what I'd like to do then is to introduce our panel. You've already met me and you've already met Jonathan. We're going to be joined by Pauline Williams, who has been a member of council at MRC for 6 years, is it now, Pauline? Yes, and Pauline has a background working in industry, most latterly with GSK. She is also our industrial guru on a board that we have formed within head office to evaluate our portfolio, which we're terming the Major Investment Board. This board contains a number of people from outside of the Strategy Board, which of course is led by our board chairs, but includes the board chairs, and is allowing us to take a very strategic view of where we have particularly big investments such as units, centres, institutes, or have made major investments such as Biobank, and look then at where the gaps are and where we would want to make future strategic investments. So that is, if you hear the MIB being referred to, that's the Major Investment Board. So Pauline, you're very welcome. We're also joined by Jennifer Anderson. Jen Anderson, many of you will know. who's head of training and careers at MRC, and does a fantastic job in what is often a very challenging environment, and Kerry Williams, who's head of strategic projects at MRC. So Jen and Kerry, you're also very welcome. Would you please, if you come up with supplementary questions, pop them in the Q&A at the bottom of your screens. And I think then, we've got 7 now. I spoke too soon, didn't I, with 3. I'm going to kick off. I'm not necessarily going to do them in chronological order. I'm going to kick off with, will the 30% increase in support for people and careers be realised through increased support for existing MRC fellowship schemes through the UKRI Future Leaders Award, or will there be new schemes launched? Now, what I'd suggest is we try and answer this both in the context of MRC's perspective, but also in the context of the potential for a plan B related to Horizon Europe. And I wonder if I might come to you, Jonathan, followed by Jen.
Well, I think maybe I'll link it, because there was a question around how will the MRC contribute to Plan B should this be necessary.
Yeah, agreed.
So I don't think it would come as a surprise, and I would hope you would be surprised if we were not giving careful consideration to what options might there be under Plan B. The government base published in July a overview of the nature of the support that might form or would form the Plan B offering if it were to be triggered. I would hasten to add that it remains the government's intent to associate with Horizon Europe, and that offer still stands, and we await the European Union's response to that offer. However, within the Plan B, there are 4 pillars, one of which is on talent and is giving clear consideration to the need to look at replacements for things like the European Research Council and other factors. There is another program looking at end-to-end innovation and ensuring that we are supporting both from the basic level, but also then through a challenge lens as well, new innovation. There's an area to increase our global collaborative efforts, and then there's an underpinning recognition that there will be need to support the infrastructure that is enabling of those other 3 pillars. So that's kind of context for a number of discussions we might have around kind of Plan B, but as I will reiterate, the government's primary intent at this point is to associate. But Jennifer.
Yes, I think the intention behind the increased, the 30% increase is to use it to increase support for existing MRC fellowship schemes, but we are always looking at different ways that we can support talent, training, careers across all spectrum. So it is likely that there might be some new schemes launched, but nothing definitive that I could say today. But yeah, definitely in the short term, increase for existing fellowship schemes, and then wait and see what happens with Plan B.
Okay, thank you both very much. That was very helpful and very clear. So I'm trying to keep with the broad themes, but we're not going to leave anyone out. Anna Hans has popped in a question on improving environmental sustainability of research going forward. Do we have a sense of the different challenges facing different researchers in different fields and types of research? Anna's noted that the MRC has a funding call on environmental stability open at present. Perhaps I'll just kick that off by saying that with the rest of UKRI, MRC is absolutely committed to achieving net zero by 2040 and halving our carbon footprints by 2030. Indeed, we actually led the way on that as a goal. Within our top team, we have an individual who leads on estates and capital, Susan Simon, and Susan has been, I have to say, really immersed in this activity for some time, and indeed is emerging as one of the key leaders, not only for MRC, but within UKRI, on developing our approach. I think the question hints at the challenges, and the questioner is correct that we have and will, where relevant, as will UKRI, create funding streams to support both an understanding and an identification of where interventions might be made to reduce the carbon output of research, without impacting, of course, on the trajectory and the momentum of research, but by way of finding practical applications to reduce the environmental impact. So I think that that 1 million funding call, which interestingly you will note is collaboratively with NERC, and it's with NERC that we are working most closely in this, is to address exactly that. But Susan, myself and colleagues have also been and continue to be quite closely involved with discussions with other key stakeholders. We are going to have a commonality of approach with the HEIs. We're going to have a commonality of approach actually with the NHS. And there is already a group that is coming together that will discuss this and discuss the ways in which we can deliver real approaches. So it's very, very active at the moment. I'm going to be slightly naughty, if I might, because I think it would be interesting to know, Pauline, what are industry doing about this at the moment?
So thanks for that, John. Well, I think we've actually discussed this at council in that certainly Big Pharma and GSK, which was my background, have made some pretty bold commitments as part of their ESG criteria. And so I think there's a lot of shared learning that institutes and MRC can have with industry, so that this is not a siloed or proprietary conversation. It's absolutely one that we should be having together. And I think where in terms of a research agenda, what we can be doing collectively and learn from each other in terms of what's working and what's not, given that we've all set such ambitious goals.
Thank you.
John, maybe if I can just add in, I mean, not only is this kind of point around sustainability really important, and one of the next steps we'll be doing, clearly the call is a great opportunity to hear from the community where they see the pinch points and opportunities for solutions is, but we're also going to be doing a landscaping exercise to get a better perspective overarchingly of where those key drivers are. Because I know when, for instance, it was done in the NHS, printing became actually a larger burden than single-use plastic. So where you might think of as being the pinch points might not necessarily be the pinch points. The other elements that are also critical for us is to look not only at what we're doing, but then what are the health impacts of climate change, both in the UK and globally, but also then what might be the health impacts of mitigations. So if we move to electrification of vehicles, actually that won't reduce the particle loads in our cities. It will probably go up because they're heavier vehicles. They need more braking, so you actually produce more brake dust. What will actually sealing our houses for better insulation mean in terms of fungal and spore build up within the inside air? So we're looking at this from a number of different lenses, and as John alluded to, that work is critically being done because we need the other disciplines in partnership with ESRC, NERC, AHRC, others, to ensure that we get the breadth of disciplines and communities needed to really understand these challenges.
Thanks, Jonathan. Moving on to other questions. We have one here. Can you provide more details on the strengthening digital and data sciences approach? And will this be through future innovation scholars schemes? Could skills development fellowships been revised and relaunched? So I guess I wonder if I could ask Jonathan Jonathan, Kerry and Jen for your thoughts on that one.
Yeah, I think, I mean, this is, as I say, a shared issue across multiple councils. We have, of course, had significant activity in this space through, for instance, Health Data Research UK and its promotion of digital and data science approaches and the skills base needed for that. I think it also links, though, into kind of wider needs within areas such as team science and how are we supportive of the multiple different expertises that are needed within an academic setting in order to prosecute this type of activity. We do very much recognize, for instance, the challenge of recruiting and retaining staff in these areas, although it is interesting that when, for instance, we discuss it with our large pharma partners, they go, oh, it's just as bad for us. We think that they all go to pharma and pharma think they all go to the city. So there is a continual need for us to consider how do we best support these capabilities, both within our own organizations, but then how do we ensure sectoral movement? So we are capturing the best of, and we've just seen, for instance, with AlphaFold, the incredible contributions that the commercial environment can make in these spaces. So how are we working in partnership to capture this as well to support it within academia?
Thank you. And that answers, or at least partly answers, one of the questions lower down about retaining talent at the postdoctoral level. Kerry, any other thoughts?
Yeah, certainly it's something that is really important to MRC and the other councils, as demonstrated through previous schemes that we've run. And also I'd like to highlight that through the new approach to unit funding, we will be very much encouraging multidisciplinarity and interdisciplinarity, because we recognise the value that those additional disciplines, whether that's data science or any other disciplines for that matter, add to the medical sciences.
Thank you. Jen, anything you wanted to add?
Just to say, it's really important to understand where the bottlenecks are, because I think wherever I go, people talk to me about skill shortages in digital and data sciences, but it's trying to understand what can MRC feasibly do within that. So, there was a reference to relaunch the skills development fellowships. Yeah, we can look at that and have been quietly looking at it behind the scenes, but whether or not that's the solution to the problem, or whether or not we need more PhD students, I think it's a collective approach. I think we need to do lots of things in lots of different places.
Great. Right, I'm going to move on to one more of the submitted questions, and then I will flip back to those that arrived ahead of kicking off, which we've amassed under sort of banners of common themes, but I think we will get time to go back over everything, so please don't worry, everybody. So let's just address can you elaborate on the Global Health Programme and the consideration, including GCRF and Newton funded approaches? Sorry, I guess this is probably Jonathan again, isn't it? And Kerry, maybe.
Yeah, no, happy to jump in there. So I think one thing which is important to understand is that this Bayes-led fund that I spoke to is funding that is in addition to the settlement that we set out both at a UKI and an MRC level. So this would be additional funding. It's looking to take the learnings of the GCRF and Newton schemes and is at the moment setting out key partner country regions, key topic areas that it would wish to be supportive of. I think they're important to recognise that we would see that as being additional opportunity, that where we have research agendas which match well with the objectives of that fund, we will work clearly with that fund in order to deliver those and to look to deliver on the fund's objectives. But if there are other areas where we feel that there is a research imperative to take that forward, we have that opportunity through our existing core budget. So I would see them as being complementary rather than an either or. So I would look at those as how do they extend our capability to do further international work.
Great, thank you very much.
John, can I just jump in
there
and just give a plug as well in terms of don't forget the private sector and industry in those partnerships. There's a huge amount of money. I think GFinder report around just shy of $500 million a year coming from the private sector into neglected diseases. So that's outside COVID. And I think that's an important for Applied Global Health Board, etc.
Great, thank you. Right, I'm now going to pick up some of the previously submitted sort of themes. This is an interesting one. Will MRC be funding pilot and feasibility studies? Traditionally, MRC is often perceived as being unkeen to fund pilot work or feasibility studies, yet engaging more with communities would require this. So I'm not sure I agree entirely with the premise, but Kerry, do you want to just say a few words and then we'll ask Jonathan?
Certainly, I think in terms of our strategy for major investments, that's certainly something we will have to consider, because there are some areas which clearly have capacity and ability to respond to themes that Major Investments Board might want to invest in, and there are other areas that may require more of a concerted effort to build the community and bring people together, and that's where we would be looking at those kind of initiatives in the future. Right,
thanks. Jonathan, anything you wanted to add?
Yeah, I mean, no, we do recognise the importance of this, and if actually I look at things like what used to be called confidence in concept, now impact accelerator accounts. I mean, they are very much to do that. They're to give the funding for that first step to build the evidence base that will then put you in a stronger position to apply for kind of large scale grant funding. We are, as we move into new areas, I know we're currently actively looking at how do we make awards within aging to stimulate new interdisciplinary activity, which would be smaller scale kind of starting work. The new interdisciplinary research funding scheme, which is at a UKRI level, is also looking at that. What is the kind of nature of starting work that would draw different communities together to build shared values, to build a research agenda over kind of necessarily then delivering upon it. So I think we would definitely look at these as being tools which we need to be using appropriately. I think it also, we've fair to say that piloting could be somewhat in the eye of the beholder. I mean, we might pilot, for instance, I described the functional genomics work, which could be a tens of £1 million project. It is a pilot. It's enabling us to take risk and learn by doing with the community, what is it that we collectively need to have in place to best prosecute against that agenda. So I think we pilot at many different levels. Just because it's financially small amount of money doesn't necessarily mean it's the only thing that we pilot.
Great, thank you. Jen, can I pitch this one to you? Please comment on MRC student support and ongoing increases to the cost of living.
Yep, so I'm assuming that refers to the recently announced 10% increase in the minimum stipend for this academic year. So that was in response to evidence that we had started to see through the new deal for postgraduate research consultation and concerns voiced by the community over the last few months. So UKRI has committed to reviewing the stipend and how it's set as part of the work that we're progressing on the new deal for postgraduate research. We're prioritising the work to inform the stipend rates for the 23-24 academic year, and we're looking to communicate that stipend level in spring of 2023, and we'll continue to engage with the community as we develop that work. On a practical point, increasing the stipend for this academic year has impacted upon future financial years, and so we're currently looking at a range of options around how we actually pay for all of that, and that could involve decreasing other investments or reducing future student recruitment. So I would say just in general, everyone's very supportive of supporting our students. We're aware of how tough it is, but it does mean increasing the stipend does mean difficult choices elsewhere.
Great, thank you. Just moving through, there's a question here: how can charities collaborate with the MRC over the next 3 years? Well, I think I'm going to answer that, which is, although I suppose that could be accused of having a conflict of interest, I am actually a trustee of the British Heart Foundation, but that's not why we had a meeting with the British Heart Foundation this morning. The simple fact is that MRC is regularly in contact and discussion with a huge range of charities. Of course, we have major partners in which we have with whom we have significant co-investment. The obvious examples being Cancer Research UK and the Wellcome Trust and the funding of the CRIC. But there isn't a week goes by when either myself, Jonathan, Kerry, Jen, others you see on this call, Rob Buckle, aren't in conversation with our equivalents at the major charities, and not infrequently with smaller charities as well. And I think one of the exciting things about our new unit model, which we're shortly about to launch, and it will be called an MRC Core, a Centre of Research Excellence, will be the new title, is the opportunity to co-fund those, and that indeed has been the subject of discussions with charitable partners in the last few weeks. So we work very closely.
Maybe if I could just add to that, John, as well. I mean, I think we've had very good discussions with, for instance, Association for Medical Research Charities around sustainability and full economic costing, and the dual support model. And we would fully recognise that we are collectively stronger together. I mean, the work of the charities and their disease focus, and actually really importantly for us, their connectivity with patients is very much complements the work that we do, which tends to be more disease agnostic and is the capability and underpinning nature which then can be prosecuted into specific diseases, but it's the system that works effectively. So it's in our joint interest that we're working both on a one-to-one basis, but also collectively that we're working together to make the case for the need for long-term support in the field.
Thanks, Jonathan, and agreed, that's a very good point, that AMRC perspective. Okay, well, that's really largely the themes that came out of the pre-submitted questions. So I'm just going to go back to the Q&A function now, or is it, have I missed one? Have I missed one? Oh, yes, I have. Sorry. Jonathan, one for you. What focus will the MRC have on toxicology-based projects that have a focus on onset exacerbation of disease mechanisms?
Well, toxicology clearly, I mean, it's a primary link. And actually, the work that I was just discussing on, for instance, environment change and understanding the impacts of changing pollutants. So we have a forthcoming joint council meeting with NERC. So Pauline and colleagues from our council will be meeting with colleagues from NERC's council to explore shared areas of interest. And the three areas that we're currently looking to explore are planetary health, particularly the impacts of climate change on health, pollution, and then mitigation, both reducing and mitigating the impacts of carbon and the implications for health for that. So that linkage between what's the driving nature of the change and then the mechanisms, and we've seen some really beautiful work, most recently as an example, out of the CRIC, the work that actually provided the mechanistic linkage between PM 2.5 and unfortunate patients develop lung cancer without a smoking history, and understanding the inflammation pathways that then trigger underlying risk, genetic risk perspectives. So that linkage, and I think that's one of the real opportunity and challenges, is how do we take these big scale changes but actually understand how they are driving and exacerbating disease mechanisms so we can think of more targeted preventative approaches.
Great, thank you very much. So going back to the Q&A, we have a question: how is MRC tackling retention of minority groups via the objectives laid out in the new delivery plan? Well, before we go to colleagues, I'd like to say a little word about a few words about that. I think that the questioner is right to talk about retention of minority groups, but actually we have really quite a significant problem in the UK, which is our pipeline of suitably qualified individuals contributing to our research community and reaching sufficient seniority to contribute to MRC's work on board and funding committees. And I feel very strongly that the MRC doesn't do anybody any good by simply trying to identify senior people that can be parachuted onto a board or another. I think it's really crucially incumbent upon us to find ways of enhancing the cadre of individuals from minority and underrepresented groups who can contribute. And I think there are two sides to this. One is the activities that go on in head office, and there are a number of changes that we've made, including the system through which we approve advertisements, the phrasing of advertisements, the descriptors used in job plans and job descriptions, particularly during recruitment, and ensurance that we have balanced shortlists. We are establishing a board diversity scheme to ensure that we offer individuals from underrepresented communities the opportunity to come and join boards in a mentored and supported way, in a manner similar to that has been trialled in some areas in the NHS, which has been very successful in bringing individuals onto the position where they can take on those sorts of roles. We've been very active with our existing units and particularly our institutes in expecting of them quite ambitious equality and diversity programs, included in that thinking about this concept that I brought up earlier of the need essentially to create a pipeline. This interest, this ability to contribute starts at school, and we have therefore components of MRC funded work where individual researchers will actually do outreach work in schools. This is also true of our institutes, working through internships, in some cases dedicated fellowship programs, and trying to develop that pipeline in addition to retaining those that are already within the system and committed to it. And to give you an example of approaches to, for example, retention, we've introduced an active bystander scheme to encourage the calling out of behaviours that might be or are contributory to those from minorities feeling excluded or marginalised. And indeed, part of the active bystander scheme isn't just for them to be called out, but it's also, of course, for colleagues to rally around and support those who have been affected by such behaviours. So there is much going on, but we have a really long journey to travel. I think that's true across many areas in the UK, but particularly in science. So I would ask for the support of the whole community. I know that HEIs are on a similar journey to contribute to this important activity. So,
John, can I just jump in?
Pauline, do please. Yes.
Yes, sorry, I just want to credit you because what you said was incredibly important, but you also act as a real personal champion for this. And we see this in council meetings, for example, where every single meeting we have, you've carved out time at the end to ensure that every discussion, every decision we make has had inclusion and diversity at the heart of it, and a similar conversation about sustainability. So I just did want to call that out because, you know, quite often this is sort of nice things to say, but you do build it into practice on a daily basis. So thank you.
Well, that's kind of you, but it is so important for us all, and we need your help, colleagues, as we travel this challenging journey. Thank you, Pauline. Right, we've got a technical question now. New funding system. Please, can you clarify how the transition between GES and the new funding system will work? Will there be gaps where researchers and offices will not be able to submit applications? Well, I think the answer to the final part is we do not anticipate having any gaps, and we are working night and day to try and prevent that. I'm not sure that we've equipped the panel really to answer the technicalities of the question. Is there anything, Jonathan, Kerry or Jen, you'd like to add?
I'm just going to jump in because I was at a workshop earlier today around the funding service. So I think, yeah, it's actively being looked at about how we try and work between the two systems. And I think everyone within MRC recognises how important it is to keep the response mode funding calls going, and so we'll work really hard to make sure that there's no gap for you. But it's not clear at this point because I think we're having to work out how we transition over.
Okay, thank you. But do, colleagues, please be reassured, we don't want there to be any gaps. It's not part of our plan or agenda. Okay, so I think, Kerry and Jonathan, one for you. With respect to increasing international collaborations, will the MRC consider joint funding with the NIH in the US or NHRC in Australia, for example? This is fairly straightforward. Kerry, do you want to kick off and then we'll ask Jonathan?
Yeah, absolutely. I think international collaborations are really important to us. And we do work with other international funders, whether that be kind of money on the table, joint calls, or whether it's in terms of discussing joint strategy and having strategic activities behind the scenes, which we do with a whole range of different funders. I'm sure Jonathan will have a lot more to add than I will around that.
Well, I think you're right. I mean, Rob and I had a meeting with our equivalent organisation in Germany a week and a half ago with exactly those kind of challenges in mind. Jonathan.
Yeah, no, definitely, indeed. And I was only last week preparing a brief for Ottilie Laser, who was traveling to the US to have discussions, including with NIH and other US funders, to seed the ground of kind of areas of shared interest. And to this audience, perhaps not surprising, of course, then actually trying to work in partnership with the scale of the US can sometimes prove an interesting challenge. But nonetheless, we do see the great opportunity of working in partnership, both with them and other leading countries around the world.
Thank you. Jonathan, I'm going to stay with you, and it'd be useful to hear Pauline's perspective if she'd be kind enough, having seen this at council. Question: do we have specific plans to remove barriers to interdisciplinarity and to promote it?
So in terms of plans, I mean, there are plans at the UKRI level. I already mentioned the plan to establish an interdisciplinary response mode scheme, which would provide a bottom-up opportunity for teams to really set out the breakthrough areas of opportunity that they see. Within the strategic theme work within UKRI, it's implicitly interdisciplinary, but I think we need to also be clear here, of course, interdisciplinary is a means to an end. There are kind of toolkits, ways of working, respect for different cultures, disciplines that we need to build up in doing it, and we can be enabling of that, but it should be a means to an end rather than an end of itself. In terms of working across sectors, we're also very keen to capture those as positive opportunities where they add value. Maybe just as an example, where we've differed actually to some of our other council colleagues in the past. We know other councils, for instance, if you had an industrial partner, would give you another half a mark in your scoring criteria. We found that was entirely unnecessary, because if you had an industrial partner, you were already scoring about one better than the competition anyway, because you brought the right skill sets together. So I think it's really around ensuring that we've got the right mechanisms to be supportive of the change, but then also the right recognition of the valuable contributions that different disciplines and sectors bring to our work.
Thank you. Pauline, what's your perspective? Because you've watched the creation of if you had the benefit of being on council, and watched the creation of UKRI and this new opportunity for interdisciplinarity sort of rise up.
Well, yeah, I mean, just to reiterate a point around industry academic collaboration, because I think the MRC has been at the forefront of breaking down those silos for a long time, and there's been a shift, really a considerable shift over the last decade on that, and also promoting porosity across sectors. I think interdisciplinarity, I mean, I think it is really coming to the fore now in terms of, I'm not sure. Well, I won't talk about UKRI driving this, because I think it was already there essentially in terms of the necessity in order to drive the innovation that we collectively have as our objective. But I would say it is also a big topic of conversation in the Major Investment Board that you introduced, John, in terms of how those new units that will be funded over a long period of time and get around particular themes will really have interdisciplinarity at the core. And then a third point, which I think is just interesting to just throw out there for you to consider, is whether or not we need to be thinking about a new generation of students coming through that have interdisciplinarity built into their own training, as opposed to be thinking that you've got to bring different people together to get those skill sets. Can we train people up that have got multiple skills?
Thank you. Right, folks, I'm really sorry. We're approaching the end of our allocated hour. I spy we've got 2 further questions which at present are unanswered. We will answer those offline so that we've dealt with all of your Q's and A's. Could I just thank all of our presenters, those on the panel. It's been a terrific session. I'd also like to thank all of you for participating. Thank you for the excellent questions, and also to recognise that, of course, in the genesis of the Strategic Delivery Plan, many of you contributed as stakeholders as part of that engagement process. So thank you all very much. I think this is going to go on our YouTube channel. Is that correct? Am I right, Sarah?
Yeah, that's correct. Yeah, and we can circulate it around to others that haven't been able to attend.
So look, thanks everyone, and have a great rest of Monday afternoon. Bye-bye.